Hi, good day to everyone. Hope everyone is fine. My name is Aung. I am an upper gastrointestinal and bariatric surgeon from Singapore. It is my great honor and pleasure to interview Professor Dror from Israel for his published paper, which was chosen by IFSO committee for upcoming Journal Club webinar, which will be held online on 21st January 2021, 2 to 3 p.m. Central European Time. Professor Dicker is Professor of Internal Medicine Department, Hashron Hospital, Rabin Medical Center in Israel, and he is also the Professor of Sacral School of Medicine, Tel Aviv University, Israel. Hi, Professor Dicker. Nice meeting you online. Congratulations again for your work, which was recently published in IFSO Official Journal, Obesity Surgery, and also being selected for IFSO Journal Club. Hi, Professor. Can you share with us about your article, which is the all-cause mortality for patients with and without diabetes following bariatric surgery, comparison to non-surgical matched patients? Hello, Dr. Dicker. Can I ask you a few questions regarding your studies? The first, I would like to ask you about about your survival benefit of the bariatric surgery for obese patients and the benefit which are seen more in the obese diabetes patients compared to obese non-diabetes patients. May I ask your opinion on that, Professor Dicker?
Yes. Hello, Professor Min. Thank you for the great honor for the opportunity to present our work. So the effect of bariatric surgery on diabetic patient mortality is scarce in the literature. So we don't have a lot of studies that really examine this point of the effect on mortality in this special diabetic patients. So we want to really examine and compare the effect of bariatric surgery on mortality in diabetic patient compared to this effect in non-diabetic patients. In addition, we compare the three surgery that was popular in Israel: band, sleeve, and Roux-en-Y. So what we found is that the effect of the three bariatric surgery on mortality in diabetic patient is very impressive. Those who had the bariatric surgery compared to those who didn't had 50%, around 50% less mortality in 4.2 years compared to non-surgery patients. Meaning the effect of bariatric surgery on mortality in diabetic patient was very, very impressive. When we did this analysis in non-diabetic patients, we found a significant effect only in the band procedure. In the sleeve and in the Roux-en-Y, we didn't find significant effect on mortality in those patients who have been operated compared to those who didn't have. Now we had more than 33,000 patients. So, and we did match control for every operated patient. We took 3 non-operated patients. So we had a very large cohort to compare. So the conclusion was that in those 4.2 years, the advantage on mortality of the bariatric surgery was mainly in diabetic patient and not in non-diabetic patients.
Thank you, Dr. Dicker. Thanks for your very interesting the research work. I really enjoy reading your research work. And also, I'd like to follow with the other questions. So in your study, you mentioned that most of the non-surgical patients are found to be lower socioeconomic status. What will be your opinion on that low socioeconomic status affecting the outcomes in your research work? Thank you, Dr. Dicker.
So, of course, in the nature of retrospective studies is that you have confounders. When we look on the socioeconomic status, indeed, the percentage of low socioeconomic status was higher in the non-surgery group. But when we look on the comorbidities of these groups in the diabetic non-surgery group and the non-diabetic non-surgery group, those who with the low socioeconomic status. So the comorbidities were lower than the operated group, meaning that the effect of the socioeconomic status did not affect, as we supposed, we hypothesized this thing. We didn't see any effect of the socioeconomic status on the comorbidities. So we think that the low socioeconomic status, or the difference between the groups, did not affect the results. Also, we adjusted for the socioeconomic study in the final model, and we didn't see that this adjustment for the socioeconomic status affect the results. So what we really found is that diabetic patient has the most benefit from bariatric surgery in the short time after operation. In order to get as we see here now in the SOS study that was just published in the New England, the SOS study, they had around 17% diabetic patients, and the effect of the reduced mortality took more than 11 years. So if we really want to see effect in the non-diabetic group, we have to wait longer than 4 years. But if you want to look on the other side, those who really operate or the great benefit very. That's why when we are prioritize the surgery, I think we have to prioritize the diabetic patient in the early stages, and then we can really achieve a significant effect on mortality.
Thank you very much, Professor Dicker. I think we have a lot more to discuss. For looking forward to your actual the journal club on 21st of January. So with this opportunity, I would like to invite all of you to join our actual IFSO journal club on 21st January. Please visit IFSO website, IFSO social media pages for more information on the registration to join our webinar, which is free registration for all. Wishing you all a happy, healthy, and prosperous 2021. See you all online on 21st January 2021. Please take care and stay safe, everyone. Thank you very much. Goodbye, Dr. Dicker. See you again soon.
Bye. Happy New Year.
Happy New Year.